Hello and a very good afternoon to all of those who are joining me live on the Facebook page of News 9. I'm Neha. Secretary of State for Health and Social Care Matt Hancock issued a warning to people of the United Kingdom, stating that nationwide lockdown could be imposed in the UK if people fail to adhere to COVID-19 norms. He said, and I quote, "We face a choice. If people break the rules, then we are more likely to end up with national measures." He also said that the country is at a quote-unquote tipping point. The government has already announced that fines will start at £1,000 for breaches of self-isolation restrictions, rising to £10,000 for repeat offenders. Boris Johnson, the United Kingdom Prime Minister, also said that the country needs to do all in their might to curb the spread of the highly contagious disease. He said, and I quote, "We need to do all we can to control the spread of this virus, to prevent the most vulnerable people from becoming infected, and to protect the NHS and save lives." In fact, while this is the case on one side, on the other side, there are several people who are quite critical of the Boris Johnson's government. London Mayor Sadiq Khan is pushing for new restrictions, including a 10 p.m. pub curfew. While hitting out at the Boris Johnson government, he said the current government has failed to deal with the situation. He further said, "Unfortunately, and it gives me no pleasure to say this, we have all been catastrophically let down by the government," quote unquote. Well, to speak more about the growing trajectory of coronavirus cases in the United Kingdom, joining me live is Dr. Neeraj Patil, straight from London. Thank you very much, Dr. Patil, and good morning to you. First of all, sir, what is the reason behind the sudden increase in the COVID-19 cases across the UK? Was it perhaps on expected lines, or did it take the authorities by surprise?
Well, it was expected that when the lockdown measures would be eased and when people start moving around, when schools starts to open, businesses start to open, everybody expected that there would be a surge in the number of cases. Yes, there is a surge in the number of cases, no doubt about it. But let me tell you, on the contrary, the hospitals are much more better equipped to cope up this surge. And unlike the surge that happened in April, May, this surge, I would say, has not had such an adverse impact on the National Health Service like we saw in April. And one of the things is, yes, the government test and trace policy, test, trace and isolate policy has failed. So the thing is, now they have to come up with some measures to control the spread of the disease and somehow also protect the economy, especially the hospitality industry, which has taken a very big hit. And there are a lot of job losses in this sector. So it's a balance which the government is struggling to do.
Exactly about that, Dr. Patil. How do we strike a balance between keeping the economy alive and running and curbing the spread?
Yes, this thing is, if you look at governments across the world, all the governments across the world are trying to get this balance between spread of disease and keep the economy going. Now, again, there is no right or wrong thing. Yes, best practices can be copied from elsewhere. Now, as far as UK is concerned, now they're coming up with a lockdown that will extend from 10 p.m. onwards. Now, a lockdown from 10 p.m. onwards will adversely affect the hospitality industry, because most of the dinners, the pubs, they start to get filled up after 10 o'clock. Now, again, there is a huge surge in the number of cases. And let me tell you, unlike the surge that happened earlier, this surge is more because the government is testing more. Okay, it's because we are testing more, we are seeing more. It's not like the same surge we saw in April. So comparing the surge in April to this surge in September, is not correct, because this surge is different from that surge. Because in April we are not having testing everyone. Now there is more testing and people are more aware, and people have been compliant till now as far as social distancing measures is concerned.
Right.
But now increasingly people are getting fatigued with complying. One of the studies have shown that only 20% of the population is fully complying with the social distancing measures, and remaining 60% are so in between, and remaining the other 20% are not at all complying with the social
Right.
distancing measures or all the healthcare measures. So there is a growing concern. As I said, there is no right or wrong answer, and no government has been able to strike the balance
True.
between opening the economy and controlling the surge of the disease.
But Dr. Patil, will the nationwide lockdown really help in the long run, given the fact that, as you also mentioned, onus is on the people to adhere to COVID-19 norms? So is there no other alternative to make people understand the seriousness of the situation?
See, the thing is, it's not going to be a nationwide lockdown. I don't think we can go back to the same kind of a complete lockdown of the economy like we saw in the months of April, May, because that would be catastrophic. And second thing is, the schools and universities have started. I don't think the schools and universities are likely to shut down, because already there is enough evidence to show that people under the age of 25 or people under the age of 50 who haven't got any comorbidities, the mortality in that group is far less. So let's do a targeted approach, targeting the vulnerable population, making sure we protect the vulnerable population. So that's the kind of approach where it will be more a targeted lockdown rather than a complete lockdown, what we saw earlier.
Right.
And the thing is, I don't expect that any economies in the world could afford now a complete lockdown. It will be an economic catastrophe. And what we could see is, yes, there has been surge in cases, and there are hot spots within United Kingdom, like Bolton. Bolton is a hot spot. So the lockdown measures could be more stricter in a place like Bolton rather than in Northern Ireland, where the disease is not spreading so fast.
Right. So, Dr. Patil, if you would be able to tell us what's the reason behind the sudden surge in the number of cases that one gets to witness in the UK, and also, was the rise in numbers not kept in check earlier? Why wait till, as he says, it reaches the tipping point?
See, the thing is, the surge was expected. There was no doubt about it, because when you ease the lockdown, the surge was expected. But no, they didn't expect the surge to be this big. It is an unexpected surge. And the other thing is, now the test and trace system test, trace and isolate system has not been working well in the United Kingdom. So the government is not able to come up with a policy decision about doing a targeted lockdowns to particular areas of the country.
Okay.
But the good thing is, the NHS is so far coping very well. So people who are seriously ill with COVID-19, there is enough capacity to treat them. There is no shortage of ICU beds or ventilators. So no shortage of PPE equipments. So that bit is well taken care of. So we have to wait and see what can be done to bring this graph down.
All right. Lastly, Dr. Patil, in your view, does lockdown really help in bringing down the numbers or keeping COVID-19 in check? And if yes, then should India follow suit given the rise in the number of cases?
See, again, as far as India is concerned, yes, India is still the first graph is only going up. Forget about the second peak. I feel very sorry because if you look at the graph, right? I wouldn't be surprised that in the next 1 month, India will overtake United States of America as the country with the highest number of COVID-19 patients. So India is still in the first surge. So we're talking here about the second surge here. Okay. Now, as far as India is concerned, my sincere suggestion is making sure that the hospital beds are available for people who really and genuinely need a hospital bed. And I have seen, it pains me a lot of celebrities, VIPs, politicians just going and getting themselves admitted in the hospital, even if they are not symptomatic. They're just getting into the hospitals and getting admitted. By this, they are taking up a bed for somebody who genuinely needs it. As I said, in the United Kingdom, 95% of the COVID-19 patients can be treated at home with simple symptomatic treatment, isolation, and that should be observed.
Right.
Only when your oxygen saturations drop, only when your fever goes out of control, only when you become more severely ill, you need to go into hospital. But what's happening in India is, people who have money are getting admitted into the hospital, while the people who are poor, who don't have money, are dying. So that injustice India has to rectify itself.
Right. Thank you so very much, Dr. Patil, for joining us with all of those important insights. Well, if it is not only about the United Kingdom, but about the rest of the countries as well, the entire world is still battling COVID-19, and vaccine as of now also is a distant dream. Please take all the preventive measures and make sure that you're keeping yourself as well as your loved ones safe. Please wear a mask and wear it properly. Don't cover your mouth and chin. You're supposed to cover your nose as well. Thank you very much for joining me. Take care of yourself. And if at all you like this video, do not forget to subscribe News9 YouTube. Thank you for watching.